all of its branches.
Which one is this one, right? Okay.
This one.
Okay.
And the posterior mesenteric, or ventral mesenteric, whichever one you want to call it, is that one that branches to the descending colon and rectum. Okay.
Thank you.
There, you're welcome. There's your iliolumbar artery and vein. This is the uterine horn, and this is the uterine horn. The ovary I had out before, I opened the ostium and looked at the ovary. There it is right there. Not a very big structure. All right. Urinary bladder. Now, since we have a female, we want to take a look down there, but we're going to do something else before that. Ovarian artery going to the left side. There should be one coming to the right side, but that has been destroyed, and so I'm not sure I could find it if I wanted to spend the time looking for it. But at least we have one left ovarian. The vein on the left side from the ovary connects to the left renal. On the right side, the right ovarian vein connects directly to the inferior vena cava. And this is actually the artery. The vein I do not see. When you get to the posterior end, do not cut the ureter. That's your urethra, urinary bladder, urethra. And now they are the circulatory system. The pelvic and femoral circulatory system in the venous system of the cat is like the arterial and venous system of the human. You have a common iliac, you have an internal iliac, and an external iliac. In the venous system of the cat, you only have that. You have the same vessels, but on the arterial system, there is no common iliac artery. There's only a common iliac vein in the cat. In the human, you have common iliac artery and vein, you have external iliac artery and vein, and you have internal iliac artery and vein in the human. That system only applies to the venous system in the cat. There's your dorsal aorta at its very end, where you have, well, not the very end, but it's close enough. This will work. There's your iliolumbar artery and iliolumbar vein. This is descending aorta, and the first major branches going through right and left are the external iliac artery. Then the dorsal aorta continues for about 8 millimeters, and you have branches that come off going to the deep muscles, the internal iliac artery. The dorsal aorta beyond that point continues as the caudal artery. So this is dorsal aorta, this little piece here between the external iliac artery and the internal iliac artery. The venous system has a common iliac vein and a vessel coming in from the dorsal side. It's quite large. That vessel is known as the internal iliac vein. It's dorsal, so you can't see it too well unless you pull it towards the midline, or that's your internal iliac vein. This piece beyond that is the external iliac vein. Then it goes through the body wall out onto the leg and becomes the femoral. At the point where it goes through the body wall, you get a blood vessel that drains the area of the pelvic region, and that vessel is known as the deep femoral. And I'm holding up both the deep femoral vein and the deep femoral artery. This is simply femoral artery and vein. And then they pass out onto the leg, and they pass out to the end of the femur and behind the leg. Move you on for a minute so I don't stab you. And there they become the popliteal behind the femur, lying pretty much on the popliteal surface. Right. That's enough for today.